Facebook Live. We're going to talk about estradiol tonight. But first, let me cover a few bookkeeping matters. Please, if you haven't, click on my thunderclaps. I have two going on now. One for MTHFR. By the way, my MTHFR book, you helped it. It was the #1 healthcare medical book on all of Amazon for almost 3 weeks. It was also in the Amazon Top 100 out of 40 million books. It's really good. If you haven't had a chance, download that. On Kindle, it's only $2.99 now. It's a bargain. It'll always be updated on Kindle, so it's super cool. Also, I have my new progesterone, PMS, progesterone thunderclap up now. Please click on it. It's super easy. It's free to click. I encourage your friends to. They can download my progesterone book for free now. And that also has been in the Amazon Top 100. It's #2 right now on healthcare for women. And it's just a great little book if you haven't already got it. Now, this week we also are launching our estradiol course to go with our progesterone course. For those of you who haven't had this or bought this course before, now's a chance to grab it. It's danpursermd.com/estradiol, or the progesterone course is danpursermd.com/progesterone. If you want to grab either one of those courses, you can look at videos and look at the information about them and decide if you want one. So don't forget to click on my thunderclaps. It's really helpful. And don't forget to grab one of my courses if you don't already have them. Let's start with discuss about estradiol. Estradiol is a hormone that is produced in your ovaries. You produce a couple of well, that's the main hormone you produce in your ovaries. You also produce estradiol, and in your gut you produce estrone. Those are the 3 major hormones in the estrogen family for women. But estradiol is the one that has all the benefits and does all the wonderful things for you. So we're going to answer questions tonight, like we always do, about estradiol this time. So Brecken, if you'll help me, please. Thank you.
Why do you just talk about estradiol and not estrogens?
Estradiol is the main hormone. That's it's called E2, the short version name for it, and it's the one that gives you all the benefits. It hardens your bones, makes you a woman, keeps your hair thick and beautiful, your nails thick, your bones hard, prevents heart attacks, strokes, diabetes. Does a lot of really wonderful things for you as a woman, and that's the one that counts, and it's the one I always replace. Estradiol, which is the other one that a lot of doctors talk about, called E3. I don't like it. It's not very breast friendly. It increases the risk for breast cancer some, while estradiol does not. And it's a little problematic. So,
are there other estrogens?
Yep, just like I said, estradiol and estrone. Estrone, women, when you eat foods that contain precursors to estrone, you form estrone in your gut, like in your stomach or your small bowel, places like that, and it's produced. It comes out of your liver as estrone. So there's estradiol, estriol, and estrone. There's also a 4th form of estrogen called estretol, and you make that when you're pregnant.
Don't estrogens cause cancer, especially breast cancer?
Don't estrogens cause cancer, especially breast cancer? No, actually they don't. You might increase your risk a little with estriol, but estradiol especially does not cause breast cancer. Estradiol, when supplemented, actually reduces breast cancer risk by 30%. Some really good studies on this. It's also a common misconception among physicians that estradiol or estrogens cause cancer. The receptors for estrogens can be found on breast cancer cells. It doesn't mean that it's caused those breast cancer cells to occur, though, or to form. It's like saying a rusty tire caused, or the rim caused a wreck in a car. It had nothing to do with the wreck, but just because it was found on the car later after it wrecked. Same with a cell. Just because the receptor is found on the cell doesn't mean it caused it. Go ahead. Next question.
Are there any foods that help produce estrogen?
Yes, of course, soy-based foods can really help, and other kinds of milk products and stuff like that can help with estrogen. So I don't know beyond that. There's probably lots of things that can, but I know soy will. So
Does taking estradiol cause clots?
does taking estradiol cause clots? I'm repeating your question, so remind me if I don't. They can in some rare women. The ones who have factor V Leiden disease, and there's some other clotting disorders they can have. It tends to run in families. It's a genetic problem. So if your mom had clots with either birth control pills or with taking Premarin or Estradiol or anything like that, you might be at risk for having clots. So you need to be tested before you take it.
When ovaries are shutting down in premenopause, is it helpful to start taking estradiol?
Let me back up to the question I just answered. We're talking strictly oral estradiol there. Topical estradiol isn't always associated with causing clots. And some people will not, some women it will not cause clots, while oral estradiol will tend to cause clots, especially if you're outside what's known as a 10-year window. The 10-year window occurs when it's been 10 years since you've gone through menopause, whether surgical or natural, and you've quit taking oral estradiol, or you've quit taking oral estradiol. Anyway, 10 years have gone by with no estradiol in your body. Topical estradiol doesn't count, it has to be oral. Then you're at increased risk for clot, stroke, or heart attack if you start on any form of estrogen that's oral at that point. Now, that question, the second question she asked me was,
when your ovaries start shutting down in premenopause, is it helpful to start taking estrogen or estradiol?
When your ovaries are shutting down in premenopause, usually what drops first is progesterone levels. When the menopause is completed and you haven't had a period for 6 months, that's classic postmenopausal situation, and you need to start on the estradiol and or substances that are very close to it. As there are some essential oils like clary sage that can mimic it or really help stimulate production of estradiol. We're not sure what it's doing, but it definitely raises levels of estradiol in women who are postmenopausal, which is an interesting essential oil product.
Does estradiol cause strokes or heart attacks?
Well, it can cause clots in some women who have factor V Leiden. The horse estrogen product out there can cause clots, strokes, heart attacks. Actually, it has a 220% increased risk of strokes in women who take the horse-based estrogen Premarin. Lots of studies have confirmed that.
I'm 32 and my doctor says I have estrogen dominance and wants to do a partial hysterectomy, leaving me with only one ovary. Your thoughts?
She's 32, she has estrogen dominance, and the doctor wants to do a partial hysterectomy and leaving her with one ovary. You know what? When you have estrogen dominance, the key isn't to bring the estrogen down. Estrogen is what makes you a woman. It gives you tons of incredible benefits, especially when you're producing your own ovaries. What you need to do is bring your progesterone level up. That'll stop the estrogen dominance and give you huge benefits. You always should balance estrogen with progesterone anyway. But if you have estrogen dominance, don't bring your estrogen down. Bring your progesterone levels up.
What is estrogen dominance exactly?
Estrogen dominance is where you feel bloated, you have breast tenderness, enlargement, you have crazy heavy bleeding or periods that are almost constant, and your estrogen level is really high compared to your progesterone level.
I have osteoporosis. Will estradiol help?
So if someone has osteoporosis, will estradiol help? Absolutely. The oral form more so than the topical form if you're postmenopausal, but estradiol is incredibly good for osteoporosis. It's the hormone that drives the minerals like calcium, D3, magnesium, zinc, things like that into the bone and hardens them. So that along with progesterone and testosterone can really help with osteoporosis. Sorry.
What do you prefer, cream or capsules?
I always prefer the capsules. Studies have shown the creams don't work very well. Capsules or tablets give you a lot more benefits. The oral version does. Oral oral estradiol will reduce your risk for heart attack and stroke and diabetes, while topical or creams won't. The patches won't do that. Those are the 3 top killers in women, by the way. Also, estradiol will reduce your risk for breast cancer 30%. Sorry about that. Okay, feeling better. Go ahead.
30 years old with estrogen dominance. How do I know I'm getting enough progesterone?
30 years old with estrogen dominance. Well, if your periods have normalized or lightened up or become non-existent, you're probably getting plenty of progesterone. If you're sleeping good, if your breasts don't feel super bloated and you're not swollen all over, you're probably getting enough progesterone at that point. Also, you can check levels. I like to see progesterone levels above 10 nanograms per deciliter, and estradiol levels at that point, when your progesterone is that good, I don't care. Usually in a young girl, like in her 20s, who's healthy, her progesterone level can be 20 nanograms per deciliter or higher, her serum progesterone levels. And when they're that healthy, it doesn't matter what their estradiol levels are.
Does Premarin really contain horse estrogen? Why? Is it safe?
Does Premarin contain horse estrogen? Why is it safe? Well, the name says it all. It's pregnant mares. It's derived from pregnant mares' urine, and that's where they got the name for it. And I don't think it's safe. Conjugated equine estrogens are a real problem. They increase breast cancer risk by about 240%, and they increase stroke and heart attack risk by 220%. So it's a little bit of a problem. And I think there's much better options out there. So they definitely helped a lot of women. Don't get me wrong on that, but its time has passed, I think.
I have acne on my chin and a tiny bit of hair. Could it be my liver or my hormones? I'm using progesterone.
She's got a little bit of facial hair and acne. It could be her hormones. Her DHEA may be too high, or testosterone may be too high. I don't think it has anything to do with progesterone or with estradiol.
Does conjugated equine estrogens cause breast cancer?
Do conjugated equine estrogens cause breast cancer? Yeah. Well, I don't know about causing. They're associated with an increased risk of 220% for breast cancer. I think it's higher, 240%. Yes.
Does estrogen play a role in male PMS?
Does estrogen play a role in male PMS? No, usually male PMS is lack of enough testosterone. And men can create too much estradiol from their testosterone. That needs to be dealt with appropriately by the physician involved. But and the man may develop like breast buds or they call them man boobs, stuff like that. That can happen. But yeah, you can have problems with too much production of estradiol, but usually it's not enough testosterone. So what's causing the male PMS, as some people call it. Oh, I do have an estradiol course. You might want to check it out if you have a lot of questions about estradiol. Why should you take it? What's the references? What's the literature say? Don't forget to check it out at danpursermd.com /estradiol, and you can look at the course there. Decide if you want to grab it or not. It's really full of a lot of good information, and there's some downloads you can do. If you take the course, you can get information sheets full of like benefits of estrogens and stuff like that, or estradiol in this case. It also goes hand in hand with my progesterone course. And next week we'll have a testosterone course up that's really good and been really popular. So please look at all those. That'll be next week though. And if you're wondering about what your doctor's doing with your menopause, or you just want to gather more information, educate yourself, and kind of DIY it yourself, then then check out my courses, please. danpursermd.com/estradiol or /progesterone. Like I said, next week, testosterone. And then there'll be one for osteoporosis and thyroid too. And I've also got an MTHFR course coming out and one on heavy metal and copper toxicity coming out. I just spoke Saturday to the American Association of Naturopathic Physicians, their natural national meeting in up in Snowbird, Utah. And I talked about copper toxicity and how it can cause fibromyalgia. We've done some interesting studies. I've got a big article coming out in some pain journals about fibromyalgia and copper toxicity. So you're going to be hearing more about that over the next 6 months to a year. It's pretty groundbreaking stuff. So it's really cool. My fibro patients get really healthy when we lower their non-cerebral plasma bound copper levels or their copper levels. It's really a easy and interesting theory and way to treat them. We're having a lot of good results with that. So.
During perimenopause, if symptoms are intense despite taking progesterone, what else could be done?
During perimenopause, if symptoms are intense despite taking progesterone, what else can be done? They may need a little estradiol cream. They may need testosterone cream, or they may need to increase their progesterone levels. Just because you're taking it doesn't mean you're getting enough. So they have to look at levels, see where they're at, find out what symptoms they're having, what they mean by really intense, as they said, and stuff like that. I just need more data.
Someone asked if you have a course on infertility. Is that covered in the progesterone course now?
No, I don't have a course on infertility. It's definitely not in my wheelhouse. I apologize. It's in the course. Oh yeah, so don't forget. Really, a couple of posts about my 2 thunderclaps, my MTHFR one. Please click on that. It's free to do so. We're just spreading the word about MTHFR, how it can increase your risk for birth defects, cause fatigue and stuff. And my other thunderclap is on progesterone PMS, how women can get help naturally, and get my book for free on progesterone. I had to pay for the thunderclap, and I'm not making any money off the Kindle book, so just giving it away, just trying to educate women out there. If you have friends who have bad PMS or hot flashes or night sweats or whatever, tell them to download the book, and please, please click on my thunderclap. All you ladies out there, it'd be really helpful. Spread the gospel about these natural hormones. So,
is there anything with weight gain and estradiol? Is that related?
Is there anything with weight gain and estradiol? I think too much estradiol causes fluid retention. Remember the estrogen dominance thing, you feel all bloated and stuff. So yeah, it can cause weight gain. Progesterone, however, and testosterone have shown to cause weight loss and increased musculature and fitness and everything else. Estradiol unopposed is a little problematic. So if you're going to take estradiol or increase your estradiol levels, you need to offset it with progesterone and probably a little testosterone too.
Can estradiol cause hot flashes?
Can estradiol cause hot flashes? No, but in about 3% of women who have hot flashes, it's from lack of estradiol that they have them. I've never been told or heard from a patient that her estradiol caused hot flashes. Lack of progesterone is the biggest cause of hot flashes and night sweats.
Is it possible that Mariana has triggered fibromyalgia and arthritis?
Oh, is it possible that Marina, the IUD with the norgestrel tip, that's a synthetic progestational agent, which you guys know I don't like, could it set off fibromyalgia causes, stuff like that? Yeah, boy, you know, if any of you have fibromyalgia that's really, really torturing you and want to consider some really natural approach to it, might help. It's super inexpensive to do. Get a hold of my office or email. You can email appointments at aespmi.com and connect with me. We'll talk. I'll explain how to do it, some options for what you can do, and a lot of you are distributors for a particular company I dearly love. I'm not going to mention, and that company I believe is developing a product just for that kind of um, metal problem that we've been talking about. So heavy metals and stuff like that. So
65, postmenopausal, never had a hot flash, never had night sweats, I sleep well, no symptoms of anything. Do I need progesterone or any natural hormones?
65, went through menopause, piece of cake, no problems, no symptoms, never any problems. Does she need any hormones or progesterone or anything like that? I don't know. There's kind of a couple rules that first, if it's not broke, don't try and fix it. But from a preventive medicine standpoint, and that's really how I started all this. I wrote a textbook on preventive medicine. You can see it on my Dan Person MD author page on Amazon. I probably would. The estradiol can protect you. The progesterone can protect you. Progesterone, for example, in 1981, the American Journal of Epidemiology did a huge review article where they saw that progesterone, normal progesterone levels above 10 nanograms per deciliter gives you a 500% plus decrease in breast cancer risk, while 1,000% decreased risk in cancer death risk overall. And that's crazy. That's just from progesterone. Estradiol does similar type things, just not as potent. So yeah, if you want to have osteoporosis, have receding gums, lose your hair, or get all wrinkly and age before your time, don't take the bioidentical hormones or essential oils that can support your hormones.
What level do you like progesterone and estradiol to be at while you're in menopause?
I like them to be normal. That of a younger, healthier female, who's 30. So I want to see the progesterone level above 10 nanograms per deciliter, 10, and the estradiol above a 50.
How do I know if I'm getting enough progesterone at night if it makes me tired when I use it?
If it's making you tired the next day, once you get up, you're probably taking too much. If you're sleeping good and you're not hot flashing, not sweating, your PMS is non-existent, stuff like that, you're getting enough. But if you're overly tired the next day, you may be taking too much. That's kind of the best way to know.
I'm a heavy weightlifter and cardio. Would this cause me to burn through my estradiol? My symptoms are mouth pain and dryness.
That's low testosterone. So our symptoms are mouth pain, dryness. I'm assuming oral dryness, eye dryness, maybe vaginal dryness. That's always low testosterone. I would take a product with DHEA in it. And if you don't have a family history of breast cancer that's significant, take the DHEA. And I'd probably consider maybe doing something to increase your testosterone levels. I don't know how old this person is or what their health issues are.
36 years old, had a total hysterectomy at 29, been on an estrogen patch twice a week since then, and has lymph nodes and right axillary that are really bothering her. She sleeps awful and is tired all the time.
Can they hear that all right? I need to repeat all that. 36-year-old, she's on a patch, had a hysterectomy at 29. I probably want to see a SpectraCell comprehensive micronutrient panel to see why she's so fatigued. I'd want to look at her other levels. Patch, I think, just in my personal practice, in my humble opinion, would be inadequate for my patients. She's still within the 10-year window. It's only been 7 years. So I'd probably switch her to oral estradiol, add progesterone RDTs or some progesterone option for her, and make sure her testosterone level is good. And really let her get her hormones dialed up to a much better level. It sounds like they're really low. And make sure she doesn't have any vitamin deficiencies. That's someone who can have osteoporosis by the time she's 50, and really needs to be aware of that.
Has a large cyst on ovary, possibly endometriosis. Doctor says I'm about 2.5 years away from menopause. Is there anything I can do right now?
Yeah, I'd take lots of progesterone. That's what I do if you're a patient in my practice. I take lots of progesterone. It's probably the best treatment for endometriosis out there. It's always my go-to, first of all and foremost. And you can usually help with most cases of endometriosis. It may not rupture the cyst. Cysts come and go. Women have them all the time. There's various causes for them. They're just more as an annoyance or curse when you have them. I'm sorry you have that. Yeah, I take more progesterone at this point. You're probably perimenopause. Your doctors wisely thought that you're about 2.5 years away. Perimenopause can last for 10 years or 15 years or 20 even. Some women get it. It's when your ovaries start to decline, the progesterone levels drop. So, and that's why, for example, Progestence Plus is so popular among young living distributors. 14,000 women a month buy Progestence Plus. That's a lot because they really like what it does, and they're probably in some form of perimenopause or close.
16-year-old childhood cancer survivor and ovarian failure using estrogen patches and progesterone tablets as prescribed by endocrinologists. Is it a good idea to use any essential oils? Or should I?
It's always a good idea to use essential oils. They're great. I mean, use them carefully. Don't. I'm not going to gainsay what her doctor's done. It sounds good, except for well, as I said earlier, I might consider going with the oral estradiol, yeah, make sure she's getting a little bit of testosterone too, because it helps. You need some. At 16, you'd make some. So yeah, there's a lot of things you can do to fine tune her more. I'd probably add clary sage, Progestence Plus, stuff like that. But that's just me. You guys know how I am. I love the essential oil stuff.
50.
Just remind them not to make things too personal.
Yeah, don't make things too personal. Yeah, no names, stuff like that. So yeah, we don't want to violate HIPAA.
51-year-old female, been on estradiol pills 1 milligram since 2007. Recently, doctor said stop taking estradiol because it causes cancer. I stopped without tapering. Now I'm having strong bone and joint pains. Is it from the stopping of the estradiol?
I would guess it was. I don't know why he told you to stop. I've already made it clear estradiol does not cause cancer. It is associated with some cancers. Doesn't mean it caused it. You get a 30% reduction in breast cancer if you take oral estradiol. That's unopposed. If you oppose it with progesterone, it goes down even further, your breast cancer risk. So yeah, I'd probably, I don't know. Yeah, and it can affect your joints. It's one of the many benefits of estradiol, along with helping your hair stay thick and your skin stay unwrinkled and your gums and teeth intact, and your bones stay healthy. Your joints will stay healthy too. So.
If I can't find a pharmacy to do RDTs, what else do you recommend? You are a big fan of bioidentical creams, right?
Well, estradiol and testosterone cream I'll use. Progesterone cream, the studies have shown after 30 days, I think, or 60 days, they're absolutely non-effective. So I'd probably go with capsules, progesterone capsules, or as a lot of you know, there's some products out there. I can't mention them, but in this particular sentence, but you guys know the product to help her with if you know her. So, okay, that's all the questions we can handle. You guys know I love you. I appreciate your questions. I appreciate all the people watching. God bless. Click on my thunderclaps, please, and download my progesterone book for free. And if you haven't gotten my MTHFR book, the Kindle book's only $2.99. Grab it. It was the #1 healthcare medical book for almost 3 weeks on Amazon. I love you all. God bless. Go in good health.